you're absolutely right. And in the cancer wards, they still give the cancer patients, sugar and Coke and ice cream, cake.
Mm,
Um,
yeah,
and then they say no, glucose has nothing to do with cancer. So there's such a lack of knowledge that
yeah,
it's profound. It's cosmic. It's unbelievable, the
yeah.
lack of knowledge on the part of the healthcare industry as to what should and should not be done to keep people healthy.
Yeah, that's one of the things, I sort of was, was a bit upset there because I see this every day in the hospital. I see the food that they feed them. It's just sugary carbs. That's it.
Yeah,
And there's almost no meat. There's certainly no fat. There's a bit of dairy, but it's always like chocolate milk as opposed to just
yeah, yeah.
normal
I
milk.
know.
And the rest of it is just garbage. And
Yeah,
I'm going around seeing our brain tumor patients and who just underwent surgery, and here they are eating all this sugary nonsense, and I just can't help but think, I mean, like, this is what gave you this problem in the first place, and we're just shoveling it into your face.
yeah. It drives the tumor, and what we also found, I published a major paper on this with the standard of care for brain cancer. The very treatments that are used, the radiation, as
Mm,
well as temozolomide, they free up massive amounts of glucose and glutamine in the tumor microenvironment,
mm,
making long-term survival very, very rare. So it's the therapies themselves that, in other words, that's bad enough to have a glioblastoma.
mhm,
It's even worse to use standard of care to treat it because you've more or less signed and sealed the death certificate of this patient simply by the human brain should rarely, if ever, be irradiated. This is nonsense. This has to stop. People,
mhm.
I published a clear paper on how the radiation breaks apart the glutamine glutamate cycle in the brain, freeing up massive amounts of glutamine, and the steroids they give these patients increases blood sugar. The
Yeah,
two fuels necessary for causing cancer cells to grow out of control are made available in abundant quantities by the very treatments that we're doing to these patients.
yeah.
So we have made no advance in glioblastoma therapy in almost 100 years.